New at 5, the emergency room at Huntsville Hospital is packed with patients needing care. Problem is there's not enough staff to keep up with that need.
WAAY 31's Olivia Schuler joins us live now after speaking with the emergency room director. Olivia, how's the ER staff handling this patient overload?
Yeah, Marie, the ER director says her staff is doing absolutely everything they can to treat patients. Even when patients are waiting for a bed during that time, they are checking vitals and running tests. But one woman tells me her husband was in the hospital just a few days ago, and he had to wait for 5 hours sitting in a chair with a broken back to get a bed.
Husband was roofing a small shop in our backyard, and he slipped off the roof.
Hours passed. Deborah Nowland says her husband was experiencing level 9 out of 10 pain, but the only option they had was to wait.
He did get an x-ray sometime during that period of time, but was never seen by a doctor during those 5 hours.
Nowland says at one point there was about 50 people piled into the ER, some more injured than others.
And there was a man there that was covered in blood, and he kept bleeding.
ER Director Dr. Sherry Squires says patients with the most critical injuries or trauma are treated first.
And if you come in with something and you're having a heart attack, you're having a stroke, you've had a trauma and your vital signs aren't stable, you are going to be treated immediately.
If that's not the case, patients like George Nowland are asked to take a C. But what's causing the ER lobby congestion lies with staffing.
It's a huge staffing issue. A lot of nurses have quit, not just nurses, but techs, transporters, radiology workers. A lot of people have quit healthcare.
The hospital created an LPN academy to try and hire more staff. They're also looking at other ways to handle the patient volume.
We're remodeling an area that used to be part of an ICU waiting room that we took and we're using for patient care.
The construction should be complete in 2 months and help patients similar to George Nowland. He's now home and recovering.
My husband is doing quite well. He's in physical therapy.
Dr. Squires says in emergency room, the overwhelmedness is really a problem nationwide. She said right now they're seeing more pediatric emergency cases as well as more suicidal and psychiatric emergencies. Reporting live in Huntsville, Olivia Schuler, WAAY 31 News.
All right, thank you, Olivia. Huntsville Hospital says they also don't have enough beds. Dr. Squires says they've had more than 20 admitted patients held in the ER while waiting for a bed in other departments. The emergency room only has 68 beds available.